According to reports, the proposed U.S. Ebola quarantine facility would isolate and monitor American citizens exposed to Ebola in the region, including possible positive cases, amid a fresh outbreak centered in the Democratic Republic of the Congo. Kenya had reportedly approved the proposal, with health officials defending the discussions as part of broader international cooperation on disease preparedness and emergency response.
International collaborations happen every other day. And when there is a discussion around having an isolation center in Kenya, it's not a bad thing, really. And it's a discussion. Because emergence of diseases and reemerging of diseases will keep recurring every other time.
Reports suggesting that Ebola-exposed Americans could be monitored or treated in Kenya had quickly triggered public debate and concern among medics, civil society groups, and ordinary citizens. The Kenya Medical Practitioners and Dentist Union now says the proposal raises serious questions about safety and preparedness.
This is akin to importing an illness with a sure bet that it will spread to the surrounding communities. We will experience a definite system strain. The Kenyan system is not as well versed as the American system.
Kenya and the United States have maintained close cooperation in public health for decades, including partnerships on HIV and AIDS programs, laboratory strengthening, disease surveillance, and emergency response systems through agencies such as the U.S. Centers for Disease Control and Prevention. Washington had announced a $13.5 million funding to help Kenya secure critical medical supplies and strengthen the country's capacity to respond to possible Ebola cases. But some experts warn that hosting an Ebola isolation facility could expose Kenya to major risks.
What happens then if the virus leaves some of the confines of this, center, and maybe moves into a major urban area like Nairobi or Mombasa or Kisumu or even some of our major towns? It really creates major problems, for Kenya also, just having this CDC center, right? And some people have asked why it's not possible then maybe to have this center in the DRC, at the center of where this problem is.
The Africa CDC has warned that at least 11 countries bordering Uganda and the DRC, including Kenya, remain at risk due to regional movements and trade connectivity. Enock, Sikolia, CGTN, Nairobi, Kenya.